President Trump concedes COVID-19 is going to get worse before it gets better. But can the United States stop the coronavirus without a plan, a national plan? Let's get perspective from Dr. Bob Arnot, the award-winning journalist, former chief medical correspondent for NBC and CBS News. He joins us from Stowe, Vermont. All right, Bob, do we need a national plan?
Larry, we absolutely do need a national plan. It's been completely incoherent at this point. I think the Washington Post said the president had incinerated his presidency. Harsh language, but when you look at what had been done, there was this overall race to open up. And as you and I talked 2 months ago, opening up did not mean going to the bar. It did not mean sporting events or going to movie theaters. It meant very, very careful opening up. So we need a national plan, and we need a school plan. People are terrified after they see what happened under the president's watch in the South with all the deaths that you have there. What will happen now with schools? Because there is no great plan. I have a 7-year-old going into second grade, and I'm very fearful of the way these plans are being put together because they're not using science.
We have 11 Miami Marlins players and coaches with positive. They've canceled their games against the Orioles. The Yankees games in Philadelphia are canceled. Could, possibly after starting, could the baseball season end?
It may already have ended. As with any of these, there are very smart ways to have done this. In other words, you would have taken baseball teams, perhaps taken a campus someplace. They all could have quarantined for a couple of weeks ahead of time and played their games. But unless you're changing the rules of the virus, you simply can't put all these active people together who are going out to bars, their families, and back and forth, especially in places like Florida that have such a high prevalence of disease. It's just not possible. Again, the interesting thing about this, Larry, is that the science is very simple. You say 10 feet away from people, you wear a very high quality mask. You use eyewear, and you stay away from crowded indoor spaces with no ventilation. And chances are very good you're not going to get infected. But unfortunately, you have politics getting in the way. The science advisors have been pushed to the side in just a race to open up any way that industries can. People have done it very smart. Look at the airlines. You look at Delta and Southwest, and you look at JetBlue. They keep the middle seats open. They're opening up smart. Other airlines are just throwing caution to the wind. So again, I'd say, if there's one summary comment, Larry, it is stay away from the rush to open up at all costs. Listen to the scientists. Don't mock them. Don't make fun of them in the newspapers. And we're going to be fine.
President said it could get worse before it gets better. You agree?
I do, and here's why. I did a course in January on the virus talking about Wuhan. In Wuhan, the virus went up like this. They used what they call mobile cabins, where anybody who had been exposed to somebody with the virus, not even infected, but exposed to them, was isolated, and they went right down to zero. What we did, Larry, is we came up like this, we came down a little bit, and now we've gone up like this. So now we have this huge base, and no one knows what's really going to happen. I mean, it's a base to really be able to accelerate this epidemic completely out of control, especially in the southern states and California.
I don't think I've ever asked this, but frankly, what is so peculiar about the coronavirus?
Well, unfortunately, Larry, there's nothing terribly peculiar about it. It's very straightforward. It's a virus that is spread largely through respiratory droplets, should drop within 3 feet or so. It should have been very easy to contain. There were systems set up in China. If we had regular testing early in February and March, we would have been able to contain it. But it's a very insightful question, Larry, because the one thing that may be unusual is this. Even though most scientists think it's not airborne as a virus, you have both the National Academy of Sciences coming out, and now the World Health Organization, spurred by about 238 scientists, asking, is it airborne? And to be clear, what we mean by airborne is when it launches into the air, we think it just drops in 3 feet or so. But the open question is, does it launch and stay in the air as a viable virus so that some distance in time away from somebody, they could become infected? So that would be the wild card. You get great insight, Larry.
President says that someday it may just disappear. You buy that?
I think it's very wishful thinking. Unfortunately, it's been wishful thinking on every front. This may be with us through 2022. Google announced today that they're going to keep their workers at home through next July. That's a year from now. And Tony Fauci, who's a fantastic infectious disease expert, despite the fact that he's been attacked by his own administration, indicates that this may be with us like the common cold for a very long period of time, precisely because we didn't stamp it out early when we had an opportunity. There may be a reservoir, so it picks up in the southern hemisphere, it comes to the northern, the southern, so it could be with us for a while. But here's the thing to watch out for, Larry. Is there going to be a big surprise? They're talking about perhaps a therapy in the next week or two will be announced. We don't know whether it's any good or not. We know that now they have 30,000 people now taking this vaccine at 87 different centers. And it's well designed. I love the idea. Technically, it's called an mRNA, and that's the messenger that comes from our genes that tells us to do something. It tells us to make the spike protein. That's what the body recognizes on the virus. So we then can make antibodies to that and have a response. So I think that just in the darkest days, I'm hoping that there is going to be an effective vaccine and some effective therapies. But look to November, December before we really know for sure.
Speaking of that, we got 15,000 people testing the vaccine, getting the vaccine, and 15,000 getting a placebo. How long will that take? What are you expectant of some good news there?
So, as you point out, there are three different phases really to these trials. The first is small. You want to find out, are people getting rashes? Are they getting medically sick? Is it bad for you? Could it hurt you? Then they go to a larger phase 2, and now phase 3, which could actually prove it out. So what they're looking for is this. When you have the virus, you have these antibodies that rise and rise and rise and rise, so your body tries to fight it. What you want to do with the vaccine is to mimic that same high rise in antibodies, and they have been able to show that. Now, the unanswered question is this. As you give it to older people and different ethnic groups, as an example, will there be a surprise that someone has a bad reaction to it? And will it, in the end, actually prevent you from getting the virus? You don't know. Makes sense. You have all those antibodies, but we won't really know probably until November. But still very promising that those antibody levels are quite high as if you actually had the virus, which is good news.
What do you make of vaccine deniers? Apparently, there are a lot of people who won't take a vaccine.
We had it happen right here. I'm in Stowe, Vermont. We had a bunch of anti-vaxxers coming to town trying to discourage our kids. What we did as a local group here, as we pointed out that in Minnesota, when they did this with a Somali population, I think they had 52 cases of measles that broke through when they didn't take the vaccine. It's going to be a big problem. It might be as much as a third of the United States. And I think the most unfortunate thing is, Larry, you may not remember, what you do remember is we've been doing this for 30 years. And 30 years ago, if we had this conversation, people would listen to the science, they listen to the evidence, and they probably take the advice. Now you have this huge universe of conspiracy theorists who think that this is, China attacking us, which of course is not correct, who think that it's, the left wing trying to beat Trump. I mean, all this, just insane stuff. And you can't break through. As a scientist, I have actually stopped most of my social media posts because all I do is get this terrible blowback from trying to just offer simple scientific advice. So to answer your question directly, yes, it's going to be a very big problem. There are large segments of the population that won't vaccinate themselves and won't vaccinate their children. So it's going to be tough sledding ahead. But we hope, as we've seen with the virus now, that the non-believers, when they get sick with this virus and die from the virus, suddenly say, hey, this is the great truth teller. And Larry, I think the most interesting point is this. We have been through the most divisive time in American history. And people sort of believe, whatever their side of the political spectrum happens to say. The virus is the great truth teller. You can have a governor in the South saying, I'm going to throw my science away. I'm going to go full bore. I'm going to open it up, go back to the bars. But the virus will prove them wrong with 5,000 deaths, 400,000 plus infected. So it's going to be very interesting that in the end, people may end up listening to the virus as it tells us, the unfortunate truth of who lives and who dies.
The annual flu vaccine should probably be available the middle of August. Will there be any problem in taking the standard flu vaccine we get every year?
Well, it's a very good question. You don't know until a large number of people take it whether there's going to be any problem with it. There hasn't been over the last few years. The question is, did they nail it? They look around for viruses around the world to see which one they have number. They have an H number and they have an N number, like H1N1. So they try to get 2 or 3 different strains to figure out, is this the right strain or not? So one, will they have the right strains? We don't know. 2, is it a good idea? It's a great idea because of the confusion that's going to be sown as people get both flu and corona at the same time. You kind of can't tell them apart, and you could really overwhelm the hospital system. So no advance warning that it's either not going to work or going to be problematic. And I'm going to sign up for one as early as I can, and I'm going to get my family to get vaccinated as well.
Me too. What if I wanted to volunteer to test one of the new vaccines? What do I do?
You would volunteer. I would have to go through the mechanics of it. The National Institutes of Health usually has all the clinical trials there and all the information on how you sign up, whether it's a cancer or a heart trial or whatnot. Moderna is one of the vaccines. It's in Oxford. The Chad-1 vaccine is another of those. But they would look at you and your risk factors. The difficulty, of course, is you don't know, as you pointed out at the beginning of the broadcast, whether you're getting salt water, you're getting the actual vaccine. But it's a great idea, because they've talked about these human volunteers taking the vaccine and then getting infected with it deliberately. But because they're younger, it doesn't really tell how it's going to operate in older individuals. So for those of us who are older or have various illnesses, I've got chronic asthma as an example, it's going to be very important for us to volunteer so that they can see how this vaccine operates in older individuals, various ethnic groups, and with a variety of what they call comorbid conditions. And for this disease, it's chronic lung disease, asthma, high blood pressure, and a long list of these chronic illnesses that put lots of people, unfortunately, terrible risk from corona.
If you test positive, are you still contagious when it's over?
Oh, so that's a great question. Actually, one of my kids just became infected with corona. It's a question we've asked. It's roughly 4.7 days after you've been infected until you start to have symptoms. And then the CDC, I think today, was saying there might be 10 days or so later that you may no longer be infectious. You probably still have antibodies for a long time out. And it's been a source of great debate, that people are continuing to sort of, trail the virus on for days. But it looks like that 10 days after you become symptomatic. But remember that at least 45% of people don't have any symptoms at all. In fact, what's interesting is in Boston, the homeless population, they found that they did all the right screening. They looked at them in terms of making certain they took their temperature and they asked all the right questions, but they missed a large number of people that had the virus because there are so many asymptomatic. And that's the main problem. You asked a great question a little while ago about, what's so different about this particular virus. The biggest single thing that's really different and dangerous about it, asymptomatic carriers, asymptomatic individuals could sit next to you and just breathing or singing, without even coughing or sneezing, you could be infected with the virus. And that's why having the right masks is important. And I say right mask because lots of people are running around with a little bit of cloth, and it doesn't do much really to contain, the virus even when you're breathing. We need to make a national priority of having the kinds of masks that healthcare workers have, but having enough of them, obviously, for healthcare workers and the rest of us. To be clear, the N95 mask offers 96% protection from the virus. A surgical mask, roughly 67%. And a single piece of cloth, we don't know, but it's probably just 20 or 30%. So, we're required to have all this expensive stuff in our cars, the airbags and the safety belts. The government should make a priority of having the right masks for everybody.
All right. Any fear, since it can get into the air, of it spreading through central air conditioning?
So it's very interesting in terms of air conditioning. It works a couple of different ways. There was a famous study, and it showed that in a restaurant, the air conditioning was actually able to take and move the virus across the room to somebody who then became infected with the virus. Now, would it go back into a central air conditioning system and spew back out again? The experience in Japan is as follows. They, number one, believed that the virus was airborne, and they have relied on these HEPA filtered systems and recirculating clean air, and it's what the airlines rely on. The airlines, big ace in the hole, they hope, we don't know this yet, they hope is that because they have the right kinds of filters and they have recirculated air, that hopefully it's going to make it lower risk. But the kind of air conditioning, in other words, just blowing virus, from me over to somebody else because of the airflow is one, and whether in fact it's airborne. The biggest million-dollar question, Larry, is this really airborne or not? And we just don't know at this point.
Bob, it's always great having you with us. Thanks for your time today.
Well, thank you, Larry. You asked the world's best questions. It's just such a pleasure and such an honor. It really is. I can't tell you how thrilled I am to see you.